You having this hearing, and thank you for the unanimous consent request to allow Ms. Stefanik to participate as well. I really want to thank our witnesses for coming, and we look forward to hearing your testimony as well. I'll keep my remarks brief to allow for a short video that I'll be playing from Ms. Janice Dean. She and her family were affected in the worst way by the deadly nursing home policies that were put in place by a handful of governors at the beginning of this pandemic. She's been very outspoken talking about and trying to highlight this issue. She's obviously got some very emotional feelings about this that she'll share. It is incredibly sad, though, that what we've seen in this past year plus is a refusal to acknowledge the deadly mistakes that were made and subsequently covered up by certain governors in nursing homes. We've highlighted this over and over again. We've called for hearings on what happened to get more transparency. We still, to this day, can't get some of that information. But we've seen thousands, tens of thousands of preventable deaths that happened because some governors gave orders, and we've highlighted these mandates over and over again by specifically 5 governors who seemed to all almost cookie cutter take the same order over and over again to go against the science, to go against the CDC and the CMS guidance for how to properly take care of nursing home patients in the nursing home setting. If you go back when the Trump administration wrote numerous documents to protect the elderly, to protect the vulnerable, especially in nursing homes, and I've included some comments from CDC, from CMS, where they talked about things like limiting visitors, increasing protective equipment, and strengthening the quarantine guidelines in nursing homes especially. Clearly, some of the states that I referenced ignored that, went against the science. Despite the cover-ups that we've seen, here's what we do know. Completely ignoring the CDC and CMS scientific recommendations that positive patients not be admitted back into nursing homes without the availability of proper care, multiple governors mandated that COVID-positive patients, in fact, be admitted or readmitted to the nursing home setting, despite the fact, in some cases, that they knew they were COVID positive. In fact, if you read the governor of New York's mandate, and again, the state of New York, like in most states, the state is the regulator of nursing homes. I'll just read from the advisory. March 25th, 2020, mandate from New York to all nursing homes, quote, no resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of COVID-19. Nursing homes are prohibited from requiring a hospitalized resident who is determined medically stable to be tested for COVID-19 prior to admission or readmission. Again, going against the science that CMS and CDC laid out, the regulator, not just New York, but then it was almost cookie cutter, cut and pasted by the governor of New Jersey. We saw the governor of Michigan do the same thing, the governor of Pennsylvania, and the governor of California all gave mandates very similarly saying that you had to, as a nursing home, take patients back, even if they were COVID positive, and prohibited them from testing for COVID. And should anybody be shocked of the results we saw? Tens of thousands of patients died who never should have died. These orders were in direct conflict with the science. We saw it with Governor Cuomo. He actively and multiple times covered up the total number of COVID-19 nursing home deaths by not reporting those nursing home residents that died in hospitals. Governor Cuomo and his team engaged in a cover-up that was designed to deceive the public and protect the governor's image and personal profits from a multi-million-dollar book deal. He had millions of reasons to cover up the truth. No wonder Governor Cuomo refused our request to testify. We asked him to testify at this very hearing, and he still to this day has not even responded. Surely he's not here, he's not participating, but he didn't even feel he owed those victims a response to the questions we had for him. I continue to be shocked that my colleagues on the other side of the aisle have largely ignored this scandal. Why is excessive and preventable death in nursing homes being made a partisan political issue? The Democrat majority has consistently used this pandemic as a political tool to divide Americans, and it has caused great harm and led to more distrust in public health. With that, Mr. Chairman, I would like to show the video from Ms. Janice Dean, because it does give some more insight into what happened specifically. If we could run that.
Chairman Clyburn, Ranking Member Scalise, and members of the Select Subcommittee on the Coronavirus Crisis. I'm sorry I can't be with you in person today, but I do appreciate this opportunity to provide a statement about the horrific, preventable tragedy that affected my family and thousands of others in New York State. On March 25th, 2020, the former governor of New York, Andrew Cuomo, along with his former health commissioner, Howard Zucker, signed an executive order that would put a Category 5 disaster into the homes where our most vulnerable lived. None of us knew that in 46 days, over 9,000 COVID-positive patients would be admitted into their residences. As the deceased were packed into body bags and piled up in storage trucks, Andrew Cuomo and his administration did everything they could to cover it up. I began my advocacy in May of 2020 on behalf of my husband's parents, who both died of COVID, which they contracted in their separate elder care facilities. I needed to find out the truth as to why our seniors were put at such grave risk. Instead of being remorseful or empathetic to our losses, I was attacked and belittled, scorned for where I work, who I might have voted for, and what I did for a living. But even a weather lady knows that putting sick patients into a nursing home is a disaster waiting to happen. Part of my job as a broadcast meteorologist is to make sure when there's a potentially deadly hurricane or a tornado outbreak, there's a dire warning in advance of those who are at risk. That's a big responsibility I take very seriously. Andrew Cuomo knew early on that our seniors were the most susceptible to the virus, and yet he said several times that if COVID got into nursing homes, it would spread like, quote, fire through dry grass. And yet neither his administration or the New York Department of Health ever alerted susceptible family members or help evacuate the residents in harm's way. Instead, they helped light the match and spread the flames. And now, over 2 years later, we still don't know why thousands of COVID patients were admitted into nursing homes instead of the other facilities provided by the federal government, such as the USS Comfort or the Jacob Javits Center. There were many options. So why did Andrew Cuomo give blanket immunity to nursing home operators days after issuing his executive order? And why did he try so hard to cover up the thousands of deaths afterwards? Did it have anything to do with his $5.2 million book he was trying to sell to the highest bidder? A closer look at the timeline and the money trail might give you some clues. But the only way we do that is by doing a thorough investigation, and one that involves subpoenas. We need to treat what happened inside nursing homes as a catastrophic event, one that could have been avoided and was made worse by the people who were supposed to protect us. A situation like this should warrant an after-action review. We must find out what happened and how we can withstand another storm like this in the future. Because if we don't find out now, it will happen again. Our families deserve answers, and we won't give up until there is justice for the thousands of precious lives that were engulfed in flames from a COVID wildfire. And thank you for your time.
Thank you, Mr. Chairman. Thank Ms. Dean, and my thoughts and prayers continue to be with Ms. Dean, with all the other family members who had loved ones who were lost during that period. We will continue, Mr. Chairman, to press for the answers. Why were these orders by the regulators of those nursing homes sent out, mandating that they do something that went against the very science that was coming out from CDC and CMS, explaining in detail how to keep seniors safe when we knew the data was there showing this is how to keep seniors safe? They went the opposite direction and forced those nursing homes to take COVID-positive patients, banning them from testing the people that were coming back into the homes, and tens of thousands of people died unnecessarily. We will continue pressing for those answers. With that, I yield back the balance of my time.